Hi there. So we are now back again at the SWAAC ELSO, the 11th Annual Conference 2025. And I will introduce myself. My name is Najuko, the guest correspondent for the podcasts at the event. And I would love to introduce to you Michel van Dyk, but I will let her introduce herself to let you know what she does.
Thank you. Thank you for having me.
You're welcome.
So I'm from South Africa. I'm an anesthesiologist and an intensivist, and I basically started ECMO in South Africa. We are running a good program and a lower cost than the rest of the world.
Okay.
So, and we've been doing ECMO since 2011.
Oh, that's amazing. That's amazing. Okay. So before we jump right into the questions, I would like to ask you, what is the feel of the event? Like, what did you enjoy most so far?
Any event is a networking opportunity, and no online event can afford that. So you have to come and connect with people. It's all about the people.
Okay.
So you can get the information and the lectures online, but you can't get the connection to people. And that's what these events are all about. This is a fantastic venue, fantastically all organized. So very, very happy to be here. Really privileged. So I think the organizing committee put together a fantastic social program, fantastic scientific program, and the venue is marvelous.
Well, it's an absolute pleasure to have you. So I will jump right into the questions. I hope you're ready. Okay, so first question. What do you think is the biggest challenge for expansion for ECMO services in Africa?
Two things, money and training.
Okay.
So, and during my term as president, I intend to focus on Africa.
Okay.
Because there's a lot that you can do. We run a training course in Pretoria, and we've trained a number of people from Africa, but that doesn't translate it into ECMO programs yet. So we need to do more training, and the international community must come to the party and help with setting up those programs. But it's also, ECMO is an expensive technology, so a lot of African countries don't have the same resources. But there's ways to do it cheaper, so we then do an ECMO patient cheaper in South Africa with the same outcomes as what they do in Europe, because we do things slightly different. And I think it's important that we learn from each other, because I think the whole world is going towards a more cost-effective strategy.
Yes, I believe so. When you mention training and money, from the training perspective, is it the individuals that receive the information, or it's the program itself?
Both.
Okay.
You can't start a ECMO program if you don't have a team.
Okay.
So I just spoke to a lady now that wants to start an ECMO program, and for her to start, we need to train the program director, the intensivist, with surgeons who will do the clinician. But mostly the nurses was going to look after these things.
Yes, true.
So the doctor's not there 24/7.
Yes.
So you need to have good nurses that's well trained, that is in the unit with those patients. And if you have a good team of nurses, you can do a lot. Just a few doctors. So I think the nurse training is the most important.
Okay.
Secondly, the doctors, and you can get away with very limited equipment. So like training, and we need to expand our training courses for Africa. Even if we go to the different countries and do the training there, instead of bringing that to our training programs.
Okay. Second question, which is my favorite question. As the future president of SWAAC, what do you think SWAAC should do to help expand ECMO services in Africa? Would it be slightly similar to the first?
I think mostly so awareness training, and if we can set up sponsorship programs for young doctors from all the different African countries so they can come and learn in different institutions. And I'm not saying just South Africa, if they can come to Europe or Australia or US and go and learn ECMO there. But a lot of people don't have the money. So the African currencies are slightly worse than the dollar.
Yeah.
So it's difficult if you a young doctor to has the money to go and train somewhere else. So I think we should try and set up sponsorship programs to go train our doctors elsewhere and then bring them back. They must not stay. Training of nurses and more awareness as well. I think we need to wrap the awareness campaigns. There's a huge amount of patients in Africa that need
Yes.
So I think, and we've got a unique problems in Africa in terms of infectious diseases, HIV, TB, pneumocystis, and it's things that the rest of the world don't know how to treat properly because they don't see as
Yes, they don't have these diseases to deal with. In your perspective, because I'm sure you've been exposed to a lot of doctors, do you believe that we have a bright future for the young doctors within this industry?
So we've got bright, enthusiastic doctors. So in South Africa, I'm trying to get the young tea together now. They need to come to these conferences. But again, they're not here because of money. But we've got they're trying to set up key CPR programs in South Africa where we don't even have proper EMS services, but they're setting up the CPR programs. They're enthusiastic and they're getting things done.
Amazing.
So it's amazing. So we look at the future's bright because we have enthusiastic in culture. You will do the work.
Oh, that's beautiful. That's beautiful.